So good day, Ma'am Sir. I am Martin Guevara, student from Davao Doctors College, from Group 54, Section 11. And today I am going to perform a return demonstration for cardiovascular system assessment. So the cardiovascular system is a system of your body that supplies oxygen and nutrients which are needed to our daily activities. So doing a cardiovascular system assessment will help identify factors that could affect our cardiovascular health, such as high blood, cholesterol, hypertension, diabetes, and some other stuff that's both common and uncommon. So for the pre-introductory phase, first is to prior to performing the procedure, review the client's medical record and check the doctor's order for the need to perform the assessment. Second, determine the scope of assessment needed, prepare necessary equipment. Third, perform hand hygiene, since I have already performed hand hygiene. Apply gloves as needed and observe other appropriate infections prevention procedures. For this assessment, we'll be needing a rectangular card, a ruler to measure our jugular venous pressure. Next is our pen light as a tangential light source. And lastly, our stethoscope to auscultate heart sound. So prior to conducting this assessment, rest assured that I already performed the hand washing and cleaned and sanitized myself before meeting the client to prevent cross-contamination. So now for the introductory phase, we are going to greet the client politely and the client's companion if around, and introduce ourselves and verify the client's identity. Also ask the client would like to be called during the assessment to establish rapport with the client. Also, we are going to explain to the client the procedure and how she or he can participate during the assessment, provide the client the opportunity to clarify, ask, or raise any concern. And also ensure the client's comfort, privacy, and confidentiality during the client's body as needed throughout the assessment. Also, inquire if the client has any existing and history of cardiovascular problem as well as lifestyle habits that are risk factors of cardio problem. So good day, ma'am. I am Martin Guevara, your student nurse for today. May I see your list, ma'am? And your state name, your age, your birthday. Okay, so how do you feel right now, ma'am? Okay, so ma'am, I want you to know if you have complication on your heart, you have difficulty on breathing, do you smoke po ba, ma'am? Okay, ma'am. So all the information that will be gathered during this assessment will remain confidential between me, your assigners, and you, your physician also. So do you have any question before we conduct this assessment? Okay, so I already closed the curtains for your privacy, and I want you to be comfortable in your position, ma'am. So do you have any clarification, ma'am? Feel free to ask if you have any concern or clarification. So now for jugular veins assessment or neck vessel, let us start with the assessment of jugular veins. Inspection of this vessel can provide information about the blood, the volume, and pressure in the right side of the plane of the heart. Now stand on the right side of the client and position the client's supine with the head of the bed elevated between 30 and 45 degrees, making sure that the head of torso are on the same plane. Instruct the client to turn the head slightly to the left and show tangential light source onto the neck, suprasternal notch and area around the clavicle, and observe two pulsation and shadows. Okay, so if jugular distension was noted, assess the jugular venous pressure by allocating the highest visible point of or distension of the internal jugular vein. Emphasize this distension with tangential lighting. Deem necessary, raise or lower the head of the bed 30, 45, 60, and 90 degrees until the highest visible point of distension of the internal jugular vein was observed. Note that the jugular vein should not be distended, bulging, or protruding at 45 degrees or greater. If so, it may indicate a right-sided heart failure. Okay, now measure the vertical distance in centimeters above the sternal angle by extending a long rectangular object or card horizontally from the point and the centimeter ruler, vertically from the sternal angle, making the exact right angle. Also now, to assessment of carotid arteries with head of the bed still slightly elevated at 30 degrees, position the client's head slightly toward the side being examined. Palpate the carotid artery, cautiously avoiding too much pressure or massaging the area. Palpating very slightly to avoid blocking circulation or triggering vagal stimulation and bradycardia, hypertension, or even cardiac arrest. And then palpate the carotid arteries individually because bilateral of the carotid arteries may result to reduce cervical blood flow. Repeat the preceding step on the other side. Okay, thank you. So now for the amplitude of stroke and for turn the client's head slightly away from the side being examined. Place the bell of the stethoscope over the carotid artery. Ask the client to hold his or her breath for a movement and auscultate the careful artery fluttering for sprawl. Root is a blowing or swishing sound that is caused by flushing blood flow through a narrowed vessel, which is obstructive or occlusive arterial disease. If root was heard, gently palpated the artery to determine the presence of thrill. Now repeat the preceding step on the other side. Now for inspection and palpation, begin with general inspection of the chest wall in women. Keep the right chest draped. Gently lifted the breast with the left hand or ask the woman to do this for assistance. Stood at the right side of the client with the knee of the bed elevated at 30 degrees and look for any abnormal pulsation shown and tangential light across the chest wall over the cardiac apex to make these movements more visible. And look for any pulsation, symmetry of movement, protraction or heaves, so heaves are strong outward, thrust of the chest. Simultaneously inspected the pericardium for pulsation while palpating aortic area, pulmonic area, tricuspid area, and apical area. First, we are going to palpate for heaves and lifts using the palm and or hold finger pads flat or obliquely against the chest. Okay, so next proceed the bell of the hand firmly against the chest wall and feel chills buzzing, vibratory sensation, feel of the skin caused by underlying turbulent flow, which indicates normally caused by an incompetent heart valve. Okay, so palpated impulses using finger pads flatly obliquely on the body surface from aortic, pulmonic, and tricuspid area. RV in the right ventricular area at the lower left sternal border and in the subscaphoid area using the palmar surface of this hand. Palpated the apical impulse using the palmar surface of 2 of 3 middle fingers, then the linear assessments palpated with 1 finger alone to confirm characteristic of the apical impulse, noting for location, diameter, and amplitude. Okay. If unable to palpate the apical impulse with the patient's supine, reposition the patient to roll partly into the left lateral side, palpated again using the palmar surfaces of several fingers. If still unable to palpate, ask the patient to exhale fully and stop breathing for a few seconds and palpate again while patient maintains to be partly facing the left side. Inhale and exhale and then hold it here. Inspected and palpated the epigastric area at the base of the sternum for abdominal aortic pulsation. Okay, ma'am, we will go back on the position. I'll palpate the For auscultation, now we are going to assess for heart rate and rhythm for placing the diaphragm of the stethoscope at the apex and listening closely to the rate and rhythm of the apical impulse. The diaphragm is used for hearing the high-pitched sounds, while the bell is needed to detect and differentiate low-pitched sounds. Count the heartbeat for a full minute. If an irregular rhythm was detected, assess for a pulse rate deficit. Now using the diaphragm of the stethoscope first, then the bell auscultated the heart in all four anatomic sites, which are the aortic, pulmonic, tricuspid, and apical area for heart sounds. Extra heart sounds and murmurs, and then ask the client to breathe regularly while auscultating. So first I am going to listen for this aortic area, which is located at the right sternal border in the second intercostal space. Moving to the pulmonic area, which is located at the left sternal border, seamed intercostal space, left intercostal space. Okay, now for the tricuspid, which is found in the left sternal border, fourth intercostal space, and for the apical area, which is located at the fifth intercostal space, mid-clavicular. Now repeat the steps while the patient is in a left lateral position, then in sitting position, leaning forward, and briefly stop breathing after exhalation. Can you roll on this side? Next, we are going to assess for each arm for size, symmetry, skin color, and temperature from fingertips to shoulder, noted for any presence of edema, lesion, changes in skin, texture, and hair distribution. Now inspect the peripheral veins in the arms for the presence and appearance of superficial veins, which limbs are dependent and which limbs are elevated. Now I will check the Okay, so temperature is warm, skin color is consistent, no venous pattern, and no lesions or any signs of edema, and the nail bed are pinkish and no clogging on nails. Now palpate for radial pulse, and then ulnar pulse, also the brachial pulse. Now I'm going to palpate first the radial pulse. So your pulse are bilateral, strong, and normal. Now I'm going to assess for capillary field. And now assessing your capillary field to check for the blood flow through peripheral tissues. Can I check for Okay, so capillary fill is good. Now I'm going to perform the Allen test, which is done to test the patency of the ulnar in the radial artery. Now ask the client to open and close the hands, see quickly as they can, and then squeeze. Now can you close open your hand as fast as you can and squeeze it? Okay. Now examining lower extremities at supine position, assess each leg for size, symmetry, skin color, and temperature from groin to toes. Note for any presence of lesion, changes in skin texture, and hair distribution. Now inspect the peripheral veins in the legs for the presence and appearance of superficial veins when limbs are dependent and the limbs are elevated. So now, ma'am, proceeding with lower extremities, I see that the color is consistent all over and the hair are evenly distributed and your skin feels warm. So now, moving to palpate for femoral pulse, popliteal pulse, and dorsalis pulse. Okay, so assess the peripheral leg veins for signs of ulceration, varicosities, and thrombophlebitis. Inspect the columns for ulceration, varicosities, redness, and swelling over vein sites. Okay, so palpate with the calls for firmness or tension of the muscle, the presence of edema over the dorsum of the foot, and areas of localized warmth. Push the calves from the side to side to feel the tenderness. The other side. So as I can see that there are no lesion, ulcerations, and edema or swelling or venous pattern or varicosities, and I'm palpating for firmness and tension. So firmly dorsiflex the client's foot while supporting the entire leg in extension. So Norman's test, or how the client stand or walk. Now, ma'am, I'm going to do the Human's test or the dorsiflexion test, which is procedure to assess for deep vein thrombosis. Okay, assesses for capillary fill for both legs. Repeated the preceding steps with other leg. Okay, now we're almost done. The summary and the closing phase. Inform the client assessment was done. It deemed necessary assist client for change clothes, reposition the clients comfortably sitting on a chair. Also summarize the information obtained during the working phase and discuss findings to the client. Discuss to the client possible plans to resolve health concern. If present, assess the client's understanding of the plan and the need for further teaching, provided the client the opportunity to clarify, ask, raise, and concern. Also thank the client for his or her cooperation and end the assessment politely. Then after care, perform hand washing and hygiene. And lastly, documented findings in the client record using printed or electronic forms of checklists supplemented by narrative notes with appropriate. Okay. Okay, so ma'am, we are almost done. For lastly, okay, ma'am, we are done with the assessment of your cardiovascular system. And just to sum up everything that we've covered, so upon auscultation, your neck, I've heard no swishing or blowing sound. Pulses are equal strong, which means normal. And there are no trails noted in your regular venous pressure is at 6 centimeters. And upon assessment of your chest wall, of your heart, so the chest movement is symmetrically, no retraction, no heaves or thrills. Ulnar pulsation or vibration are calculated in the areas of the apex, left sternal border or base, and the best rate is 75 beats per minute with irregular rhythm. So upon assessment of your upper and lower extremities, arms are bilaterally symmetric with minimal variation in size and shape. So there are no edema, formal venous puckering, your skin is warm, capillary flow is good, radial pulse and ulnar pulse, and also your brachial pulse are bilaterally strong, a regular rhythm, which is also very normal. And upon performing the ALN test, the result is good. Upon examining your legs, hair is evenly distributed and the skin is warm, no signs of edema, no lesion, no swelling. Your popliteal pulse, dorsal, and posterior pulse are all normal and equally strong. So overall, your cardiovascular system is doing very well. So I suggest you ma'am to maintain your healthy lifestyle. If you have time, please do some exercise for your better health. So do you have any concerns or clarifications po? So if there's none, thank you very much for the cooperation ma'am. Now we're done with our cardiovascular assessment. Thank you very much.